Hi, this is Dr. Matar. Today we're going to talk about how to use sleep to prevent cancer, heart disease, diabetes, obesity, and impotence. We're going to first discuss what causes sleep, what causes the brain to sleep, the body to sleep, and then what causes that process to be disrupted, and then the outcome of this being disrupted, which is cancer, heart attacks, diabetes, obesity, and impotence. And other things also, but we're not going to really bore you with all of those details. I'm just going to give you the highlights of the subject. Number one, what causes the body to sleep is the production of a chemical, of a hormone produced by the brain called melatonin. A lot of people know about melatonin. A lot of people may have taken melatonin in the past, but melatonin is basically how the brain helps you induce sleep. Melatonin is produced when there is lack of light in the immediate environment of the body. When light is not getting to the eyes, getting then to the brain, indicating that it is still daytime, the brain starts producing melatonin. Melatonin hits a peak of production in the darkest hours of the night. So ideally, we should be sleeping during the darkest hours of the night so we can get enough of that hormone. Melatonin also happens to be extremely essential for other functions in the body, not just sleep. It is one of the most potent antioxidants, anti-inflammatory chemical produced naturally by the brain. So it helps in that regard. It is a hormone that can prevent cancer. It's a hormone that can prevent diabetes. It is a hormone that can enhance the conditions and the health of your microbiome, the good bacteria that live inside of the body. And also, it is a hormone that is extremely essential in regulating your genes, especially those genes that can turn on to cause cancer and or turn off when you sleep well and have enough melatonin to prevent cancer and in many cases to heal cancer. Let's start with cancer. What kind of cancer is caused by lack of sleep? The one that's been documented the most is breast cancer. However, we also have evidence that it can cause colon cancer. It can cause cancer of the uterus. It can cause different cancers throughout the body, including prostate cancer. The way it does that is lack of melatonin, which is caused by lack of sleep, can turn on those genes that cause quite a few things that can cause eventually cancer in the body. But also, the genes that reduce the amount of specific cells, immune cells in the body that are designed to attack cancer. They have special characteristics that can allow these cells to attack a tumor and kill it. They're called natural killer cells. And if you don't have enough melatonin in the body, you'll eventually produce less and less and less, down to about 50% less. Okay, so that's on cancer. On obesity, the thing that lack of sleep does in the body is it controls the hormones, the main hormones that control your metabolism, namely insulin, ghrelin, and leptin. Leptin is produced by the fat cells, basically communicating to the brain, I have fat, you don't have to eat too much, and that helps you control your appetite. Ghrelin is produced by the stomach, indicating to the brain that I'm hungry, there's nothing in the stomach, start eating. And that gives you the signal of hunger. Insulin is how the body controls metabolism internally. It's what the body does with carbohydrates primarily. And if insulin is not being responded to by the cells of the body, then the metabolism of carbohydrates becomes really a problem for you. And then you can build fat in the cells of the body, including the liver. So there's a direct connection then between melatonin and good sleep and your body's ability to build fat throughout the body. A couple of experiments were done on rats, where rats were deprived of sleep by being exposed to a lot of light 24 hours. And those rats developed a lot of excess fat. And then The same rats were giving supplementally some melatonin, and the excess fat was gone. Okay? In humans, what happens normally when melatonin is lacking, when you stay up late, basically, what happens is you tend to consume about, on average, 1,000 calories, excess calories, after dinner, at night, into the evening, of mainly processed carbohydrates. And that is the mechanism, the behavioral mechanism of causing obesity. As far as heart disease and heart attacks, it was found through a study that was done a while back that those countries that have a shift in time where they adjust daylight by 1 hour in one direction and a few months later an hour in the other direction, they noticed that when an hour is added to your schedule, to your sleep, the next morning the incidence of heart attacks dropped by over 20% throughout the world. This is one of the biggest studies that were ever done, because this change in daylight time happens to about 1.6 billion humans on Earth. So when a study was done to cover all of these nations, they realized that, wow, on that day, the next day of everybody being deprived by 1 hour of sleep, heart attacks increased by over 20%. And they also noticed that when there's an hour that's added to your sleep, heart attacks dropped by over 20%. Okay. Also, it was noticed that your bad cholesterol goes up, including triglycerides, and your good cholesterol goes down when you're lacking sleep. Of course, sleep has a lot of effects throughout the body, but one of the things that really got a lot of people's attention as to the effect of lack of sleep was in the area of hormones, both in reduction in testosterone for men and reduction in the size of the testicles, about 50% reduction. For the testosterone, it can be even more than that. So it's very significant, causing impotence. And you know, impotence and Viagra and so forth are becoming really very rampant throughout the world. The other thing is the inability to conceive. That is now becoming a big deal. 1 out of 5 couples within perfect age to conceive are not able to conceive anymore, which is, you know, multiples of the way it used to be before. And one reason for this is because as humans, as an entire culture living our modern civilization at this time on Earth, we are lacking sleep. We sleep less than 7 hours on average, and when you sleep less than 7 hours on average, all of these things I just mentioned actually start to occur. So this is not something that we can take lightly. It's not just affecting us through changes in our mood, in our inability to interact with people during the day, because we don't have the mental energy or the physical energy to really tolerate them, including our loved ones, our kids and our spouses and so forth. Not just that, which is terrible all by itself. It is affecting our health, and it's creating a lot of disease and disability at a very huge cost. In the future videos, I'll be discussing many different ways that we've been able to isolate through coaching. We coach a lot of people on the subject of sleep, and we were able to isolate about 50 different ways, do-it-yourself type of behaviors that you can learn and you can implement in your life to improve your sleep. So be on the lookout for those videos. Thank you. Hi, this is Dr. Matar again. If you like the video, please give it a like and subscribe so you can get the future videos. If you're new to the channel, what I do here is I discuss cases of my most successful patients who struggled with diet and exercise, yet were able to achieve at the end of their programs a well, fit, and slim life. I want the same for you, so if you have any questions or comments, please send them my way. I'd love to hear from you. Thank you.